Hello, welcome to the City of Riverside Fire Department's Riverside County EMS Agency Spring 2021 Protocol and Policy Procedure Update. Today we're going to cover several things in this policy. We're going to cover reformatted the look of the manual, updating and clarified the use and definition and abbreviations, improved access to the policy manual. They rewrote the introduction of REMSA protocols and the deletion of the Universal Patient Protocol. They also cleaned up the drug and equipment and skills list. The policy manual table of contents is the 4000 series reorganization. New categories include the body system, mechanism of injury, nature of illness, updated treatment tools, the weight conversion matrix, skills list, and the ALS drug index. Policies 101 and 102 were created and updated based upon system feedback and the need to move towards a more standard approach to documentation using abbreviations and commonly used terms. Policy 101 was 9101. It was relocated to the front of the policy manual for ease of use and accessibility. Policy 102 emphasizes limiting the use of confusing abbreviations and, where appropriate, use of more recognizable abbreviations. The alternative medications policy was moved forward within the 3000 series operational policies. Policy 3306 was given the new number of 3301. The policy title was modified to be more descriptive as this policy includes the medication waiver protocol language. The drug and equipment list has been refreshed to help clarify and streamline the information. This policy was given a new number of 3303. A small change was made in how optional scope medications are referenced. Medications once labeled as optional are considered as alternative, and thus the letter A indicates the medication status as alternative. Alternative medications will include morphine, Ativan, and Valium, which have been removed from all applicable treatment protocols where they were previously recognized as substitutions for fentanyl and midazolam, respectively. Because of their new classifications, they may only be stocked and used in the event of supply limitations of fentanyl, ketamine, and/or midazolam. Policy 4101 has been rewritten and given the title, Using the Treatment Protocols. These changes make this policy focus on developing a treatment plan and is more prescriptive and less educational. It also lists the treatment protocols for each category. You will notice that policy 4102, the universal patient, has been removed. The calculation chart has been rotated from portrait to landscape to better visually accommodate the information being presented. You may notice that morphine has been removed from the preferred medication list and given the A designation for alternative medication use status. The weight conversion matrix is being introduced to assist with more accurate dosing in high stress incidents. Pediatric weights are consistent with standard length resuscitation tapes. Also, any reference to Brazil tapes has been replaced with more non-brand specific labeling. The remaining weights start at 39 kilograms or 85 pounds and increase in 5-pound increments up to 100 kilograms or 220 pounds. Policy 4104 is the newly added skills list. It lists all applicable skills for public safety personnel, emergency medical technicians, advanced emergency medical technicians, and paramedics. These skills were previously found in the Universal Patient Protocol or the performance standards. The specific skills listed are categorized by general medical, area management, cardiac care, or trauma care. The color green indicates that the skill is approved for that specific provider level within Riverside County. Red is not permitted for that level provider at that level. Skills listed in yellow have associated additional requirement for it to be an approved skill for that provider level. Policy 4105, Advanced Life Support Drug Index, has been added to the policy manual. All 24 medications are listed in the index. The drug sheet includes the drug class, actions, indications with corresponding policy number, dosages and routes, contraindications, side effects, and special information. The following policies have had a number of changes. On-scene physician wishing to assume responsibility is now policy 4106. Refusal of treatment and/or transport is now 4107. Ambulance patient offload delay is now policy 4109. And end-of-life care is now 4110. Policy 4108 had a policy change to better describe its content. Do not attempt resuscitation/discontinue resuscitation is the new title. The policy content was also reorganized and reformatted to fit the new standard protocol layout. As recommended by the EMS system providers, the treatment protocols were reformatted. Patient management columns were separated into BLS and ALS patient management columns. Each patient management section contains pertinent standing orders, base hospital orders, as they were written in the older universal patient protocols and respective policies. And the adult medication dosing has also been restored into the treatment protocols. Providers should take note of the following. Firstly, after completing a thorough assessment of the patient's complaint, condition, and clinical presentation, the primary care provider at scene will determine the primary impression of the patient's condition. Next, the primary care provider will then determine the treatment protocol that most closely aligns with the patient's complaint, condition, and clinical presentation, and begin providing care as outlined in the BLS patient management column. After all BLS treatment has been rendered, and if the patient's condition warrants continuation of treatment as outlined in the ALS patient management column should be considered. When the patient presents with multiple complaints, and appropriate treatments, medications, or procedures are contained in other multiple treatment protocols. Treatment of the most life-threatening conditions must occur first. Let's be clear, not all treatments listed in each column needs to be provided to each and every patient. Additionally, the order in which the treatments and procedures carried out is not an issue within the protocols. Remember, however, a thorough assessment of the patient's complaint, their clinical presentation, and the provider's sound judgment are required to determine the clinical necessity and appropriateness of the care selected, as well as the order in which they are rendered. As previously stated, treatment protocols have been regrouped to better reflect the body system, mechanism of injury, or nature of illness that they are associated with. The first category, which contains 4 protocols, is titled General Medical and includes symptomatic hypoglycemia, shock and limited trauma, nausea and or vomiting, and pain management. Symptomatic hypoglycemia, previously titled Hypoglycemia and Altered Mental Status. Adult medication dosing information has been added back into the body of the protocols. To additionally clarify the repeat doses that require base hospital contact, they are now clearly noted. 4300 series still contains both trauma protocols, shock due to trauma and traumatic injuries. The policy numbers and content remain unchanged. The cardiopulmonary category has been renamed to cardiovascular respiratory, and it includes the following policies: suspected acute coronary syndrome, mechanical circulatory support devices, previously titled ventricular assist devices, symptomatic tachycardia with pulses, symptomatic bradycardia with pulses, cardiac arrest, and respiratory distress. Series 4500 neurological have been renumbered. Seizures is now policy 4501, and suspected stroke is now policy 4502. The content remains unchanged, only the numbers have changed to protect the incident. Series 4600 toxicological is new and contains the protocols related to overdose, adverse reaction, behavioral emergency with suspected excited delirium, toxic exposure, inhalation or ingestion, and exposure to nerve agents, organophosphates, and carbamates. Series 4700, environmental, is also new and contains the following protocols: burns, heat illness, hyperthermia, frostbite, hypothermia, allergy and or anaphylaxis, and snakebite. OBGYN has been renamed and renumbered. It is now titled Pregnancy and Childbirth. It contains the 4800 series protocol. It relates to neonatal resuscitation, preeclampsia and eclampsia, labor and delivery. REMSA staff made some global changes within the protocols. All remaining references to King and Rescue Airways were removed, and more appropriate standard descriptive language was placed. Additionally, references related to midazolam use with base hospital order for approval of anxiety was removed from policy 4204, 4302, and 4401. 3 policies were deleted, and in some cases their content was inserted into other policy language. Policy 7201, 7301 through 7602, and policy 9102 were deleted or melded into other policies to streamline and clarify some of the policy updates. For your convenience, performance standards were packaged into easy use file posted on the Rivco REM site, rivcoems.org. The next few slides include some individual policy changes. Administrative Policy 8301 Policy Review Process, CQI, made these changes. Policy 4201, Symptomatic Hypoglycemia. Because assessing the blood glucose levels are standing orders for EMT and above, the references in the existing protocol indicating the administration of oral glucose for suspected hypoglycemia with altered mental status and the directive to obtain and evaluate a glucose level when the paramedic is present were removed. These changes align with the current standards of care, as the presence of the advanced EMT or paramedic are no longer required to obtain and evaluate a blood glucose level. Policy 4202, Shock Unrelated to Trauma. To align the language with the protocol with current standards of care, the statement, administration of TXA for shock unrelated to trauma is not permitted, was added. This means tranexamic acid, or TXA, is not permitted for use in shock not related to trauma. References to ketamine for pediatric administration in policies 4204, 4302, 4701, 4703, 4705 have been reworded to read, pediatric administration is not permitted. The phrases not indicated or none were used in the existing treatment protocols and calculation chart. These words were replaced with pediatric administration is not permitted. In policies 4301 and 4302, the repeat dose of TXA with the base hospital order has been removed from both trauma protocols. Only the initial dose is allowed while in the pre-hospital setting. The use of calcium chloride in policies 4302, 4405, 4601, 4603, and 4702 has been clarified. The language now states that calcium chloride is to be infused in 50 to 100 ml of normal saline over 10 minutes. The exception to this rule is in cardiac arrest patients. The appropriate route is still IV or IO. They have added the energy levels for the shocks delivered in synchronized cardioversion into policy 4403, symptomatic tachycardia with pulses. Policy 4405, cardiac arrest. Previous protocol language regarding the indications for oral tracheal intubation were confusing and conflicting. Within the universal patient protocol, the indication read, when required for emergency stabilization. The policy language was corrected to state, when BLS airway management is ineffective and or inadequate. A well-controlled airway using BLS skills and equipment is considered adequate and effective. To help clarify the use of colorimetric devices, the policy language was changed to read, the use of colorimetric devices is required immediately after oral tracheal intubation to confirm correct endotracheal tube placement. Only after confirmation of proper placement should waveform digital capnography be applied for continuous monitoring. A colorimetric device may be used in conjunction with waveform digital capnography, but it does not take the place of waveform digital capnography use. Within policy 4405, cardiac arrest, language from policy 4108 was added regarding discontinuing resuscitation from medical cardiac arrest patients for ease of reference. The sample from the protocol outlines the steps to be taken for considering discontinuation of resuscitation efforts. Policy 4406, respiratory distress. Clarifying language was added in regards to the use of glucagon and magnesium. The change clarified the patient differential diagnosis that would benefit most by the use of glucagon or magnesium. Make note that the dosing information has not changed. Policy 4701, preeclampsia and eclampsia. Clarifying language was added in regards to the use of magnesium sulfate for suspected preeclampsia and eclampsia. The phrase standing orders may be given prophylactically was emphasized to let you know that it is acceptable to administer magnesium sulfate to pregnant patients that you suspect to be preeclamptic or eclamptic. Also, clarification has been provided that magnesium may be administered in either 50 or 100 ml bags of normal saline. Previously, the protocol stated only 50 mLs was added. The County of Riverside is proud to introduce the REMSA Policy Manual mobile app. This app is available for iOS and Android devices. This tool is also available on your computer or tablet devices through a browser URL. Quick overview of the app. You can download it on Android App Store and the Apple App Store. So the treatment protocols are available and they're all numerically ordered. Scrolling down, they're similar to the manual, and these are all the 2021 release. So this one here, shock related to trauma, talks about patient disposition, standing orders, ALS procedures, BLS patient management. They also have med dosing is also inserted. So as you can see here, the medications are listed and whether it's a base hospital order or if it's a standing order. Again, similar to the manual. As we go back, we go down to the pediatric drug calculations. So it's kind of similar to the Broslow tape. Pediatric drug calculations are all color coded as the tape would indicate, and all the correct dosage for that specific color are indicated, easily referenced. Next on the list, we have weight-based medications. So they've kind of done the math for you. So you just go through and know the patient's weight, and it's converted to kilograms. And they're all converted on the chart listed below. Facility contacts. It's kind of a neat way of having all the hospital base station numbers listed. All the facility contacts are there, and the actual address is there as well. So if you have that patient that needs to go to the hospital and they don't know the address, you can go ahead and click on that and give them the actual address in the map. And they have the specialties as well, like RCH would be a STEMI center. There's poison controls number is on there as well as an additional resource. So you got that easily identified. And then you have a pill identifier. So if you do happen to respond on that overdose call, you can identify a visual of the pill. ALS drug index is also indicated. Home medications, contacts, out-of-county contacts, REMSA staff, and then there's an about tab just like in pretty much any app. The ALS drug index has all of your medications, actions, onset, duration, indications, contraindications, use with caution, concentration, special information. So it's all a good reference to view in the need of such. Home medications, here's a big one. So they have pretty much a very vast selection of home medications that you can pull up and reference. And it's pretty specific to what the common uses are. Trade name and generic names are also listed. Out-of-county contacts, so if we do need to go to somewhere like Kaiser, Loma Linda, Arrowhead, a burn center, Redlands Community, again, you have a map, reference, address, phone number, and you also have their specialties. That's a quick overview of the Riverside County EMS app. It is downloadable today. However, the only thing that is active is the home medications. And this app is supposed to go live in April. We covered the updates to the policy format and the additional treatment categories. We presented the new 100 and 200 series policies. We discussed in detail the updated 4100 series policies, protocols, and changes. And we presented the 9 protocols that received changes. And finally, we took a look at the new REMSA mobile app. Some operational and administrative policies may change throughout the year. There is a formal process that is used to modify protocols and policies, and they must adhere to Policy 8301. You should anticipate policy updates twice a year in April and October. You can scan the QR code listed above for the direct access to the REMS mobile app. Thanks for watching.